the Caregiver Connection podcast by Best Care, where we dive into new topics each week, drawing inspiration from our insightful and educational blog posts. We're committed to providing valuable information that impacts both home care clients and caregivers. Without further ado, let's jump into this week's episode. Using ABA therapy techniques. Applied behavior analysis, also known as ABA therapy, is a scientifically proven approach that uses positive reinforcement to encourage constructive social behaviors in children and adults living with developmental disorders. Psychology Today succinctly defines ABA therapy as a type of therapy frequently applied to children with autism and other developmental disorders that focuses on imparting skills in specific domains of functioning, such as social skills, communication, academic and learning skills, motor dexterity, hygiene and grooming, and more. Through consistent application of ABA therapy techniques, individuals such as children with autism can develop essential life skills, improve communication, and achieve greater independence. Understanding ABA therapy methodologies. At the core, ABA therapy methods aim to understand and improve specific behaviors. This is achieved through observation and intervention. Evidence-based ABA methodologies help therapists and caregivers identify the triggers of unwanted behaviors and uncover how to modify them effectively. Every ABA approach is highly individualized, recognizing that each person has unique needs and responses to different strategies. Core ABA therapy strategies. There are several fundamental ABA techniques that form the foundation of effective therapy. Positive reinforcement. This cornerstone of ABA therapy involves rewarding desired behaviors to increase their frequency. Rewards can range from verbal praise to preferred activities. Consistency is the key in ABA therapy. When positive behaviors are reliably rewarded, they are more likely to continue. Visual modeling. Many individuals learn best by watching others. This technique uses demonstrations, videos, and/or pictures to teach new skills and appropriate social interactions. Visual aids can help make abstract concepts more concrete and easier to understand. Behavior chaining. In ABA therapy, complex tasks are broken down into smaller, manageable steps. This helps individuals master activities by learning one component at a time, building confidence and independence over time. At-home ABA therapy tips. Caregivers play a crucial role in reinforcing ABA therapy techniques beyond formal therapy sessions. If you are a caregiver tasked with reinforcing ABA therapy techniques at home, talk to your recipient of care's team to understand what goals and behaviors they are targeting. Successful ABA therapy involves consistency from everyone on the care team. When working on the ABA techniques, keep these tips in mind. Implement techniques when the individual is most receptive to learning. Use the same approach across different settings. Keep track of what works and what needs adjustment. Minimize distractions during learning sessions. Document successes and challenges. Use clear, consistent communication across all interactions. Celebrate small achievements to build confidence. Stay patient during learning processes and setbacks. Maintain open communication with therapists and other caregivers. And finally, adapt strategies as needs change and skills develop. Common ABA therapy challenges and solutions. At times during the ABA therapy process, families experience inconsistent progress. Some weeks show remarkable improvements while others seem to take steps backward. Maintaining motivation can become difficult, especially when progress isn't immediately visible, and individuals receiving therapy may show resistance to new routines that disrupt their familiar patterns. Environmental distractions can also pose significant challenges, making it harder for individuals to focus on learning new skills or maintaining the desired behaviors. However, these challenges can be effectively addressed with the right approach. Start by regularly adjusting reinforcement strategies to keep them fresh and engaging. as to what works today might not work tomorrow. When tasks seem overwhelming, break them down into even smaller, more manageable steps than initially planned. Creating more engaging learning environments might mean rearranging spaces, reducing sensory inputs, or introducing new elements that support positive behaviors. Most importantly, don't hesitate to seek support from experienced professionals who can provide guidance and additional strategies tailored to your family's specific situation. Remember that progress takes time, and each individual's journey with ABA therapy is unique. The key is finding the right combination of techniques that work for your loved one and implementing them consistently and patiently. Experience support at your fingertips. The Best Care team is here to help with all of your questions related to family caregiving. Our experienced team understands the challenges and rewards of supporting individuals with developmental disorders and is ready to provide the guidance you need. Contact us today. If you find this podcast helpful, share this with a friend, leave a review, and don't forget to subscribe. Contact us today for expert guidance and support. Visit bestcaremn.com. Thanks for listening to the Caregiver Connection.